Lesson 11 will allow us to learn the various teaching methods and how to use them effectively. We will also discover the advantages and limitations of each method and when and how to use them. Lastly, we will discuss how to evaluate teaching methods in various settings. Teaching methods are defined as approaches the teacher takes to bring the learner into contact with the content to be learned. Examples include lecture, group discussion, one-to-one instruction, demonstration and return demonstration, gaming, simulation, role play, role modeling, and self-instruction modules. Lecturing is a method where the teacher verbally transmits information directly to groups of learners to educate them. It is generally passive learning and has come under criticism as it can be ineffective if not properly organized or without expertise. Lectures should have an introduction or opening statement and summary statements. The body of the lecture should contain key terms, offer examples and analogies, and use visual backups, and the conclusion should summarize the information presented again. If done effectively, the advantages are cost effectiveness, since it targets a larger audience and is useful in the cognitive domain. It is not as useful in individualizing learning or engaging learners. Group discussion is a method where learners come together to exchange information, feelings, and opinions with each other and the teacher. The clinician's role is to facilitate the discussion and tie important points together. Advantages are it is efficient, cost-effective, and engages learners by stimulating ideas and emotions. It is useful when teaching in the cognitive and affective domains. Limitations include its inability to address individual differences and diversity within the group. It can be hijacked by dominant personalities and is not as useful in the psychomotor domain. One-to-one instruction is where the teacher personally delivers content designed for the learner. It allows the clinician and patient to exchange knowledge, ideas, and feelings and can be formal as a planned activity or informal as a teachable moment. Its advantages are that learning can occur in all domains, the content can be individualized, and the learner is active. However, due to its labor intensity, it can be time-consuming and expensive to deliver, particularly in the healthcare setting, and isolate the learner from others with similar needs and put learners on the spot. Ideally, sessions should be 15 to 20 minutes and are useful with smoking cessation, weight control, diet and exercise improvements, and safer sex practices. Demonstration is a method where the learner is shown how to perform a particular skill by the teacher. It is more effective when instructions are explained verbally either prior or during the demonstration. Advantages include actively engaging the learner through multiple senses, increasing confidence and skill retention, and is effective for teaching in the psychomotor domain. Disadvantages include increased time to do it properly, equipment requirements, and to be effective, the audience size must be kept small. Return demonstration is carried out by the learner to establish competence with cues from the clinician as needed. The advantages and disadvantages are similar to the ones for demonstration. Gaming is a method requiring the learner to participate in a competitive activity with preset rules to achieve an educational objective. It is useful for stimulating enjoyment of learning, increasing active participation and engagement, and providing variety. It also enhances skill acquisition, improves problem-solving abilities, and is useful in teaching in all domains. It is particularly effective in teaching children, but may not be as attractive to others who find it too competitive, too noisy, possibly more physically demanding, and not always appropriate for learners with disabilities. Simulation is a trial and error teaching method whereby artificial experience is created that engages the learner in an activity that reflects real-life conditions, such as the clinical sims you took to become registered respiratory therapist. Again, simulation encourages active learning and is useful for teaching in all domains, and it provides a safe environment to practice real-life skills. It can be very labor-intensive and costly as not readily available to all learners. Role-playing is where learners participate in an unrehearsed dramatization to elicit their feelings to achieve effective domain objectives. It places learners in real-life situations and helps them develop understanding of other people. It is also an active learner mode, but it may not be useful for the self-conscious patient and requires rapport to be established. Learners may also overplay or underplay their roles, making this teaching method less effective. Role modeling is often overlooked as a teaching method, but is effective in influencing attitudes and behavior changes in the affective domain. Learning from role modeling is called identification, and was developed from Bandura's social learning theories and Erikson's psychological stages of development. It has the potential for instilling desired behaviors when there is a positive role model, but may do the opposite with a negative role model, and requires rapport between the role model and the learner. Self-instruction provides activities that guide the learner in independently achieving the educational objectives. Self-instruction modules should have an introduction with purpose and directions, a list of prerequisite skills, measurable behavioral objectives, outlines of learning activities and time to complete, presentations, periodic self-assessments, and post-tests. Advantages include self-pacing, cost-effectiveness, active learning, frequent feedback, and an opportunity to review and reflect on information. Disadvantages are learner motivation and procrastination, potential limitations for patients with low literacy or some disabilities. When selecting a teaching method, the following questions should be asked. What are the objectives? Who is the targeted audience and what are their characteristics? What resources are available? What are the teacher's strengths and limitations? In evaluating a teaching method, determine if the learners achieved their objectives, if the activity was accessible to the learners, if resources were adequate and cost-effective, and did it accommodate the learner's needs, abilities, and style. Some effective ways to improve lectures are to use enthusiasm, humor, drama, short stories, technology, or role modeling. For all teaching methods, clinicians should provide positive reinforcement, an attitude of acceptance and sensitivity, be organized and give thorough instructions, define objectives, ask for and give feedback, use questions to activate learning, use repetition, have patients teach or tell back information, and summarize key points. Teaching in the healthcare setting is incorporated into care of the patient and occurs in hospitals, home care, public health, outpatient clinics, extended care facilities, and physicians' offices. Health-related education may occur in settings such as associations and patient advocacy organizations and during health screenings. Examples are the American Cancer Society, and emphasis is on health promotion, disease prevention, or improvement of quality of life. Non-healthcare settings for education include businesses, industries, schools, military, or prisons, where education may occur with wellness programs or with health and safety issues. Health education committees may help establish teaching protocols across the various healthcare settings to more effectively utilize resources and prevent duplication.